You're listening to Sweet Life, the show that helps you find and walk your own special path. I'm Brooke Peterson. Here on Sweet Life, we like to explore unconventional career possibilities, self-discovery, professional development, and more. Whatever helps and whatever works to make it sweet. Who doesn't love music? I feel about music like some people feel about math. It's a universal language. Wondering where I was going with that, huh? And in the language of mathematics, music is a great common denominator. And that's why I love it so much. On the rare occasion that I meet someone who doesn't really get music, you know, it is rare. It doesn't happen very often, but sometimes there's somebody who just doesn't get music. And I'm sure I look at them like they have 5 heads or something. And I also am pretty sure that if my dog Maggie were ever to have met them, she probably would have been barking at them because something clearly just isn't right. To me, music is magical. And in fact, Dr. Oliver Sacks, who is a professor of neurology and psychology at Columbia University, says nothing activates the brain so extensively as music. And in fact, language, for instance, is in the left hemisphere of the brain. Well, music exists in both hemispheres. Music is one of the only things that exists in both hemispheres. And because of that, music is basically a bridge and a gateway for helping people in therapy to recover language. If their left hemisphere has been injured, they can help rebuild their language using music through the right hemisphere. Fascinating stuff, right? Kalani Das is a board-certified music therapist specializing in the treatment of adults with developmental disabilities, traumatic brain injury, addiction, and issues associated with aging. He is the author of over 10 books, most recently, The Way of Music, Creating Sound Connections in Music Therapy. Kalani is a frequent presenter at regional and national music therapy conferences and a music therapy drumming trainer. All right, Kalani, how are you doing today? Thank you so much for joining us.
I'm doing wonderfully, Brooke. Thank you for having me.
All right. Well, just to dive on in and to get it out of the way, how about you go ahead and tell us, what is music therapy?
Well, that is a very interesting question, and it's a question that, as a music therapist, and I know I can speak for my colleagues, we often try to answer in a number of different ways, because when people hear the term music therapy, maybe they immediately think of listening to their favorite music to relax, or playing music for someone so they can relax or they can feel better. And that's certainly a wonderful way to use music. But music therapy is actually it's an allied health profession. It's been around for over 60 years. And it is the treatment of an individual or individuals. We also do group music therapy. It's a treatment process wherein the music therapist uses musical interventions or experiences, and this relates to any kind of musical experience where it could be listening to music, it could be moving to music, it could be talking about the lyrics of a song, certainly singing songs, playing instruments, composing music, recreating music that you've learned before, improvising, all sorts of different musical experiences. And we use those experiences to help the client reach their non-musical therapeutic goals and objectives. So we have, as a music therapy, we have the same goals as, say, a occupational therapist or a physical therapist or a speech therapist, even a talk therapist. But we use musical experiences as the foundation and the container for helping the client reach their therapeutic goals and objectives.
Gotcha. Okay, so is it true that most people would basically assume that music therapy is something different, like maybe not quite so medical? For instance, your education? How much of your education is medical and like anatomical versus, learning how to play the guitar or sing or?
Yeah, that's a great question. So a music therapist has gone through an accredited music therapy program, university program. They've completed an 1,100-hour clinical internship, and they've passed a board certification exam. So the requirements are actually quite rigorous
Yeah.
About 20 to 30% of the people who begin the program don't complete the program. It's a university degree. It's 2 years of focused work in music therapy, and then a lot of people go on to receive a master's degree or PhD in music therapy.
1,100
we study
hours.
music, of course. We need to know all about music, the physical, scientific properties of music, as well as different styles of music. We learn about playing different instruments. We need to play piano, guitar, percussion. We need to be able to sing fairly well. And we need to also understand the physiology of the body and the psychology. So we study all of those topics. And there are music therapists that work in more of a medical setting. Hospitals certainly are one place where music therapy is quite prevalent, helping with all sorts of things from pain management to stroke recovery to helping people learn new skills after a traumatic injury, for example. Everything from beginning of life, could be prenatal, to end of life in hospice care.
Wow, that covers a wide range. And so, for instance, what is something that you mentioned stroke victims? And I know you said it's traumatic brain injury and acquired brain injury. And I was thinking about that earlier. Is it one of those things where traumatic brain injury is where something happens that happened outside of you, like an accident, and then acquired brain injury is something that basically happened inside of you, that something happened with your body internally that injured your brain?
Basically, that's correct, yeah. So, for example, at the Center for Neuroskills in Encino, which is one of the facilities where I work, we're helping the clients there regain physical mobility, fine motor skills, gross motor skills. So fine motor skills, of course, would be moving your hands, your fingers, your face, you're using to speak, learning to speak again. And then gross motor skills would be arms and torso and legs and that kind of thing. So what would that look like? I know people are probably wondering what it would look like. Well, for example, if I'm working on physical goals, fine motor skills, I might give the client an instrument to play or a stick to hold, a mallet to hold, that would require them to use certain muscle groups and move in a certain way. So in a way, see, I'm connecting with the same goals as a physical therapist. The reason we do it in a musical context is because, as you mentioned, everybody gets music, and music is motivational. If I bring a really cool drum or a gong or a cymbal, and I give somebody the role of hitting that thing at a certain time to make the music, punctuate the music, well, that's motivational for them. So people tend to work harder when they're doing it for a reason that they're excited about. And people love making music, and we make music together. We guide the clients. We show them what to do. They don't really need to have musical training. We take care of all that. I like to say we do the heavy lifting, and they get to kind of have the payoff. But we'll use certain instruments and give them an opportunity to use their fingers, use their hands, use their arms, use their voice. And in that way, they are exercising. They're retraining their body to do certain tasks that they can then generalize into their life. So it might be holding a mallet, so you can then hold a fork or a spoon, so you can regain the skill of feeding yourself, for example. So you no longer need a caregiver to do that for you. That's just one example, but there are many examples.
Now, when you have a new patient, because this does seem very, very therapeutic and medical, is there a process for basically, determining a course of treatment, or how does that work for each new patient for you?
Absolutely, yeah. So because music therapists are not working in just one modality, like speech therapy is very clear what that is. Physical therapy, it's really clear, what they're going to do, and it's probably clear what they're not going to do. They're not going to do, psychology when you go to the speech therapist or the physical therapist. Music therapists actually overlap with just about every other kind of therapy profession. We're a supportive therapy in that regard. And we also have unique qualities, of course, that are only existing in music therapy. What we do is we first do an assessment of the client. We meet the client. We might meet the client's caregivers and family members. We talk about their needs. We get to know who they are, what their strengths are, what their needs areas are. Once that's done, we design an individualized treatment program that focuses on targeting their specific needs, and we have objectives. And the objectives are just there to make sure that we're helping the client make meaningful progress. We target specific behaviors, specific skills, and we then design our musical intervention around those goals. So if it's a speech goal, I'm going to go to probably some songs and certain types of songs. If it's physical goals, I'll certainly think about which kind of instruments can I give them that would encourage them to move in certain ways. If it's a cognitive goal, I'm going to think about songs that have certain types of information in them. Maybe I'd pick a song that has certain lyrics, and we'd talk about those lyrics. In addiction recovery, my teacher and mentor, Ron Borzon, who runs the music therapy program at Cal State Northridge, uses stories and metaphorical learning, Greek mythology, songs with different lyrics to help people in addiction recovery gain insights into the whole addiction process and the recovery process. Incredibly effective. So once the treatment plan is in place, then we provide the services, and then we're also evaluating the client's progress over the period of weeks, and then hopefully we reach a point where we can terminate the treatment.
Mm-hmm. And how long does treatment normally last? And is it like weeks or months or years or?
It all depends on the client. It's just like other therapies. If you think about physical therapy, you'd probably go for a period of weeks. If you're, you're recovering, you're working on your body recovering. It might be months. It depends what the trauma is or what your needs are. But I'd say weeks or months.
Okay. With
regard to addiction recovery, we're probably talking about weeks or a couple months.
And
if it's yes.
Yeah, why do you think music works? Why do you think it's so effective?
Well, there's a few reasons. As you mentioned earlier, everybody gets music, and a lot of people really have a powerful, intimate relationship with music. Music is one of those things that's really important to us. And if you think about those of you that are listening, if you think about the music that you listen to in, say, middle school and high school, maybe in college as well, but when you were from about 12 to, say, 22, 23, 24 years old, that's your music, and that's the music that you shared with your friends, with your partners, your loved ones, and it's really meaningful. And one of the things that we do as music therapists is we leverage that. We leverage that power, and we use what we call preferred music to encourage people, to motivate people, and to get more out of them. And we create experiences within that music, not exclusively within that music, but we use that as a meeting place and as a bridge, like the quote you read from Oliver Sacks earlier. If we meet in the music, it creates this powerful connection between the therapist and the client. And we can use that. The therapeutic relationship is really important for any kind of therapy. What makes music therapy unique is that we have music as our partner in the room. We have music as our ally. And so in music therapy, we talk about a therapeutic triangle that involves the patient, the therapist, and the music. And that's something that makes music therapy unique, and it makes it a powerful treatment modality.
Yeah, before we're going to take a quick break, and as we go to break, I'm going to play an example of a session I went to of yours yesterday at the Center for Neuroskills in Encino, so everybody can hear a little bit of what Kalani does. And that is Kalani Das. In performing a group treatment with some patients over at the Center for Neuroskills in Encino. I was fortunate enough to join him out there yesterday, and they were so kind to let me sit in with them and observe and record, and to see what Kalani does as a music therapist. It was really fascinating. And this happened to be a group therapy session. And I'm wondering, Kalani, how that differs. How are you able to since I'm just assuming each patient is different, like you said, and unique, and they have their own challenges, how are you able to do that in a group setting?
Well, of course, we're attending to each patient individually while we're having a group experience. What I try to do is design the intervention so that everybody can participate on some level that's appropriate for him or her. And, of course, the clients do have different degrees of capacity, physical capacity, speech, cognition as they're recovering. And we can all do something together. And that's really the beauty of music, is that we can be having a community experience, and at the same time, everybody is having their individual experience. So I just check in individually. I try to give a little bit of time. I spread my attention around, and I try to make sure that each person is on task, and they're challenged, and they're also encouraged and having fun, and then at the same time to bring in that group cohesion so we can all feel like we're doing something together.
Mm-hmm. I imagine, like basically what you just said was the community aspect is probably just as therapeutic in a way as the actual exercises and songs and physical challenges, just being together.
It really is, Brooke. The value that we can create in a clinical setting, you think about a hospital setting, and as much as we love and appreciate all of the medical professionals, I don't think any of us really enjoy spending our day and nights, in a hospital.
Speak for yourself, Kalani.
We'd rather not be there. But if we can soften that environment, if we can make that environment a little more friendly, a little more comfortable, a little more familiar by bringing in music that we like, if we can help patients connect with each other and strengthen their bonds, because those are their peers, at least for that time. And it's important to make sure that they feel supported by one another as well as by their own therapists. And I think in that way, musical experiences can be incredibly powerful in a way that helps bring a comfort and familiarity and warmth to what would otherwise be a fairly cold and clinical setting.
Mm-hmm. Do you have people who resist music therapy? Like they don't want to sing along and they don't want to squeeze the instrument or whatever? Anybody who's just like, no, I'm not going to do it?
We do, and that usually happens for a number of reasons. Maybe somebody doesn't feel that they're musically competent, and so we have ways of easing people into a musical experience so that if they're afraid of singing or playing an instrument, we can give them options. We can give them ways to plug into the music so they don't feel so vulnerable or threatened. People may just not be in the mood. They might be agitated. They might have a headache. They might not feel good. We can give them maybe a way to just be in the room and listen until they feel like joining in. I had one patient with traumatic brain injury who was usually quite agitated. In fact, he had to live alone because he didn't socialize well with other people, and so my role was to help him gain a little bit of social skills so he could go out and be more social. And every time I went to his apartment, the first thing he would do is try to spit on me. And so, I got good at it. I would use my drum or my ukulele to block projectiles. But as soon as I could get into the music, as soon as I would start playing a song, and he really loved the Beatles, and if I could just find that right song, it was just like the light bulb would turn on, his face would brighten, his whole body language and affect would immediately change, and now we're best friends, and now we're playing together, and that would, it would go on, and I would, we just work on social skills and rapport, and so, people might not feel like music is the thing they want to do initially. But my experience has been that once they hear the music and it starts to kind of soak in, that they really warm up to it and start to enjoy it.
So you mentioned...
But we certainly don't want to force music on anyone, and sometimes music therapy is not the right treatment.
Right. You mentioned finding the right song. I love that idea. So you're part detective, like trial and error, finding like that special button song that really just, like you said, lights somebody up. Do you find you have to have like a repertoire of different songs for different generations? Like, because that sweet spot as we get older, from you said, like I think you said, like 12 to 18 or something, when all those happy memories with music are formed. How does that affect your repertoire and what you have to play?
Yeah, well, and that's part of the training. It's, you think about it, we're treating people who are in their 90s, all the way down to infants. And so we need to know songs from just about every era, and we need to be able to play them well and reproduce them in a way that the client's going to say, hey, yeah, that's how that song goes. And so,
and lights them up.
As you can imagine, yeah, it's a lot of work, but it's fun, and I enjoy it because I love learning all these songs. There's a lot of songs from the 20s and 30s and 40s that I didn't necessarily know before, but now I've learned a lot of songs. So, yeah, we have to know a lot of songs. Music therapists actually, we learn guitar, we learn to play piano, we sing, so we're learning all sorts of different instruments, and then we bring instruments and for the clients as well and help them play them. But the repertoire is pretty vast.
Now, what do you love most about doing what you do?
For me, as a performing musician, because I was a performing musician, I still do gigs, but I do more, I'd say, education and training. I train music educators, I train music therapists, I work in music therapy and in music education. But the thing that I really enjoy about music therapy is the personal connection with the people I'm working for and with. In performance, you have an audience, and it's really gratifying, and it's great to get applause, but there's something just super intimate and moving and personal, about helping somebody on the level of therapy. We get to know people, we get to know their stories, we share experiences, they share, parts of themselves with us, their personal stories and their lives, and it's just a wonderful way to experience other people and other people's lives. And then at the same time, I find it incredibly enriching because I feel like I grow as a person all the time. Every time I work with clients, I'm just always learning and growing myself.
Oh, so yeah. What are they teaching you? What have you learned from your clients?
I've learned unconditional acceptance. I've learned to be in the moment. Ironically, a lot of people with, say, traumatic brain injuries or acquired brain injuries or intellectual and developmental disabilities are not really worried about a lot of the stuff that the rest of us are. They tend to be more in the moment, and that's a great model for me. It's a great model for all of us. They tend to be really playful. We sometimes look at clients who don't have a lot of physical ability or expressive abilities, and we think that maybe they're not, thinking about stuff. But I'll tell you, my clients crack me up all the time. I mean, we give each other a hard time. We're making jokes. They're giving me a hard time. I'm giving them a hard time. We sort of joke around with each other, and it's wonderful. So you just never know what's going on with somebody until you can get close enough and spend enough time with them, and that musical experience is a great way to do that.
And what is the most challenging part of your job? What's something that you didn't expect going into this?
Yeah, that's a great question. There's different kinds of challenges. One is, of course, educating the public and other healthcare professionals, doctors and caregivers, as to what music therapy is and who the music therapist is. A lot of people will look at the music therapist and they'll think of like a volunteer musician that goes in to play for people, which is a wonderful thing to do. I think we need more of that. bedside musicians, that might go to a hospital and play for people. That is a service, entertainment service. A lot of the time we have to educate people as to what we're doing, which is quite different from that. So there's that challenge of educating people as to what music therapy is, who the music therapist is. One of the things that we often hear is that people say, oh, yeah, music is very powerful, or you hear people talking about the power of music to affect change. But really, and of course, as a music therapist, I always want to say, well, look, it's not just music; it's the music therapy, which includes the music therapist. It's like we wouldn't separate medicine from a doctor. That could be actually quite dangerous. So it's the two together. It's the therapist and the music. And then other challenges are just finding ways to design the right treatment program. To find the right things to fit a client. For all the reasons that we talked about, their needs, their abilities, their preference, what their mood is on a certain day. Something that worked last week may not work this week. So we're always working, very much in the moment to connect and to motivate and to move that client forward in their goals.
Yeah, staying connected and finding what's working. All right, this has been Kalani Das, a music therapist, author, performer, and trainer. To learn more about him and his work, go to gsmusictherapy.com or kalanimusic.com. And to look in on the center that I went to yesterday and see everything that they do and offer their patients, go to Center for Neuroskills, and their website is neuroskills.org. Before we go to break, we're going to listen to a little bit more of Kalani at work yesterday. Thank you so much, Kalani Das.
Thank you, Brooke.
You've been listening to Sweet Life. I'm Brooke Peterson. You can like us on Facebook by searching Sweet Life Radio Show. Until next time, make it sweet.